Hey everyone, hope all is well. This is Abdul Chaudhary and Dr. Nawaz Hussain from Starling Diagnostics. Today we are going to talk about depression. Nawaz, please start.
How you doing? So depression is a very sensitive topic. So a lot of different communities see it differently. There's a lot of stigma associated with it. They don't want to come out and talk about it. So a lot of it gets undiagnosed. Just to give you a data, in the U.S., $280 billion are spent in mental health every
Every
year,
year.
and still a lot of mental health is not being addressed, and depression is one of the main ones.
What do you define as depression?
So depression has, it's pretty broad. There's quite a few different types of depression. There are some symptoms that are more common in depression. So for example, if you're feeling down most of the time, if you feel your mood is down low, that's one of the main criteria that must be present. Or if you're losing interest in things, so like things you used to like to do before, now you don't like to do anymore. Like for example, you used to like listening to music, now you don't like it anymore. You don't like socializing. Giving up on things. So these are the two symptoms that either one has to be present. And in addition to that, there are a list of other symptoms, and out of that, like four of them have to be positive. For example, you're having trouble focusing on things, concentration, you have trouble with sleep, you're having trouble with appetite, so meaning you're either eating less or more than usual. Then you have some guilty feelings, like you feel like you're worthless or you're blaming yourself for something. And then the psychosocial disorder, like you're acting weird all of a
Right.
sudden, so that's another symptom. And then finally suicide. Okay, so that's one of the big ones, right? So if you're having like suicidal ideation, so that's one of the symptoms. So again, to recap, one or two of those must be there, which is feeling down or losing interest in things. So that has to be there. And then four of the other ones that are listed.
Right. What triggers depression? Like, we know that teenagers could have depression. We know older people can have depression. We know once a woman gives delivery, they could have depression. So what triggers it?
So there like so many different types of depression.
Right.
Okay, so one is major depressive disorders, and then there's postpartum disorder. There's something called premenstrual dysphoric disorder. There's also called disruptive mood dysregulation disorder, which is in the common in teenagers from age 6 to age 18. They could have that. And then there's disorders like bipolar disorder
Right.
has one part that's depressive symptoms. There's also called seasonal affective disorder, which means that you become depressed only certain time of the year. So like winter, every time winter comes, you feel depressed because of lack of sunlight. There's other like psychotic disorder that has associated with like delusional characteristics also. So what you were describing, teenagers is one of the main ones right now, is becoming more and more common. It's called disruptive mood dysregulation disorders. And what they do is they have sudden bursts of anger. They're very, throwing a lot of tantrums. Like their reaction is out of proportion.
Right. Right.
So that's one of the big ones.
What are the solution to this? I mean, is everyone supposed to be on a medications, or there are other solutions besides getting to a medication?
Depends on what. So going back to, sorry, your question was how do you become depressed?
Right.
What
Right. Right.
leads to depression? So there's a lot of triggers. It could be financial problems. It could be a previous past experience, and all that. How do you treat it? Is psychotherapy is one of the main ones that we look at. But first, you have to do lifestyle changes. So meaning you have to do exercise and a dietary modification, because what exercise does is it increases the good hormones, like endorphins. Okay,
Yeah.
feel good. That's what they call feel good chemicals, the endorphins. And also, exercise causes growth hormone increase. So what that does is it changes the neurons in the brain. Okay, like the hypothalamus, and that because people who are depressed, they have a small hypothalamus, and then the study showed that with exercise, the hypothalamus gets
Right.
big, reorganized, and people, that's one of the treatment first. And then, of course, if that doesn't help, then you need to go psychotherapy and medications. There are
Right.
medications to treat
Right.
depression.
So depression, the most of our patients who we, and also when you go through your annual health checkup, there are a couple of questions there
Yeah.
to kind of assess the depression.
Right. So doing annual health, they'll be asking those questions, and if you meet those criteria, then you may be diagnosed with
And
it.
with patients who has depression, okay, denial is a big factor. And let's say if I'm depressed, maybe I'm not diagnosing myself that I'm depressed. So your family member has to be really active on that end. Like, okay, this person was like this before. Suddenly there's such a change. Let's take a look at it. And sometimes that patient is not going to admit that they're depressed, or they're not going to agree that they're depressed, right?
Right. So one of the criteria for the depression is, psychomotor disorder, like where your behavior is changing and stuff. So you may not realize it, but your family members will realize
Right.
it. They will come and say, "Hey, my father is behaving like this now." Okay.
Right.
The other thing is talking about denial is, whenever we go through some type of trauma, one of the first phases that we go through is denial,
Right.
meaning like, "Oh no, this is not happening to me," right? So there's something. So like for example, if you lose a loved ones, right? So somebody dies, right? There's some short period of time that you're allowed to feel depressed, which is
Right.
grief, right?
Right. Which is
But
okay, which is
which is
part of the
okay, but
process.
not for a long time. So in the past, they used to say 2 months is okay, but now that criteria has been taken out.
Right.
So right now, because those symptoms can lead to depression, you understand? So the sooner you address it, the better it is.
Right.
Whether it be psychotherapy or medication. So that's why that criteria has been taken out recently. But grief, like maybe the first 2 weeks is okay. One of the main criteria for major depression is the symptoms have to be present for continuously present for 2 weeks minimum.
Right.
So that's one of the criteria. So if all of this grief or feeling down, if it continues for more than 2 weeks, then that should be concerning.
Something to think about.
Yeah.
And also, I also want to talk about therapies a little bit, right? Because a lot of patients, we just want to make sure that we all understand medication is not the first solution, right? You go to a psychologist, you do go through the therapies and things like that, right? And a lot of people in our communities, they don't want to do that. They feel like, oh, I don't need therapy. What the therapist can do for me.
Right. So what happens is, being human, what we do is we dwell on negative thoughts, right?
Right.
So we always remember the negatives about people or about, some fight or whatever you had. Always think about the negative.
Right.
So what psychotherapy does is it points out the negatives that you're not seeing, okay?
Right.
And it reorganizes your thoughts, okay? So psychotherapy is definitely very important. And at the end, if none of these are working, there are other options. So sometimes ECT is electrical treatment. Okay, so that is another option. And then there's transcranial magnetic therapy also.
Right.
That's
Right.
also
Right.
being studied right now.
So my last question, I think you touched on it a little bit, is when a women get pregnant, they have a lot of hormonal changes, emotional changes.
Mhm.
Then they have the birth, and a lot of times they need to take therapy because of a lot of. Can you talk about that a little bit, which get undiagnosed a lot?
Yeah. So women, first there's postpartum depression, and they also have something called premenstrual
Yeah.
dysphoric syndrome. So which means that the depression symptoms they could have like 1 week before the menstruation, and then it can go back to normal state in after 1 week of menstrual.